The first day on any new job can be an adventure. Learning your way around and getting a grip on responsibilities can be a daunting task. Just imagine if your new office was over 200 acres in size and your responsibilities included learning the care of more than 1,000 animals. That's exactly the point at which we met Dr. Meredith Weinstein. Just starting a residency at the Kansas City Zoo under the mentorship of Dr. Kirk Sudmeyer, Dr. Weinstein had a whirlwind day that included performing a biopsy on a lion, examining a kangaroo, and treating a lesser kudu. She told us this type of diversity has been her goal for a long time.
I fell in love with the Columbus Zoo at a young age, and my first year in vet school, we had one lection actually on carnivore medicine, so lions and tigers, and I knew from that minute that that's what I had to do. So I harassed the zoo vets there, and they let me come out every Sunday for about 3 years, and from there I went to a whole bunch of other zoos to get as much experience as possible. I did some marine mammal rehabilitation, went to the Houston Zoo, Cleveland Zoo, Shedd Aquarium, just a whole bunch of places. And then I spent the last 2 years at the Indianapolis Zoo doing a veterinary internship, and now I'm starting my residency for 3 more years. A lot of training. As cheesy as it is, I always liked animals. I like dogs and cats. I love my own, but I just something about it, something about every day seeing something new. I fell in love with elephants at a young age, and that led to marine mammals, and just kept going on and on. I couldn't decide what type of vet I wanted to be, so I thought I'll be a large animal vet, a small animal vet, a fish vet, a marine mammal vet. An equine vet, you can do all of that in the zoo field. So I think that's an advantage to it.
Well, this is abnormal, and we go back and forth on what is abnormal.
I had a few people ask, how could you want to do this with your life? And my response was, how could you not want to do this with your life? I just think it's such a great field. But I think that for me, some of the greatest benefits are that I get to see my patient every day. If someone goes into small animal practice and they have a dog that unfortunately gets hit by a car, and you follow up with a treatment, you don't necessarily know the outcome of that case. Whereas if we have a polar bear that's sick, that I can call the keepers, I can go down and look at it every day if I want to. I know that the keepers are going to do everything they can to give that animal their medicine, whereas some owners might not have the ability to do that. So I think that there's so many advantages to it, but I think it's the best of all worlds.
The field of zoo medicine presents a host of challenges, from the demands of caring for a wide range of species to simply finding a job.
It's pretty competitive. It's the best job in the world, but there's a reason that it is so competitive. Just so many people want to do it. There are little positions, and those are accredited by the American College of Zoological Medicine. They will credential you to sit for board exams and become a specialist like Dr. Sudmeyer. So it definitely a long haul, but I think it is possible, and why can't that person be me? I have 2 years as kind of a foundation in zoo med, and by doing an additional residency, so at the end of this will be 5 years of post-veterinary training, just focusing on zoo animals. And when I'm done with those 3 years, I still won't know everything. It's just a constant learning, constant reading, journals, finding good mentors to teach you, going to different zoos, because every time you go to a new zoo, you have to learn all new species. So I think just it's a lifelong classroom, this field. My internship was a great foundation. I mean, coming right out of school or even private practice and learning how to load a dart, all of that stuff I was fortunate in doing in my internship, and learning how to sedate a lion or a tiger. But coming here and really now getting to learn more about the different protocols and why we might use a different protocol here than what we do at a previous zoo. And I think just realizing how much I don't know, which is a lot, and I already know that. So I think that just understanding now that I have to perfect those skills and build on those and learn as much as I can, be a sponge the next 3 years.
Anyone this devoted obviously possesses a passion that extends well beyond the zoo gates. Dr. Weinstein pointed out the importance of zoos in terms of conservation and of zoo medicine in carrying the torch for endangered species.
I think that without zoos, a lot of these species I truly believe would be extinct. And I think that by doing some of the breeding programs that we can, we're kind of like giving a second chance to those animals that might be destroyed by mankind, or we're giving them a shot.
Okay, given that your mentor is standing right there, if you had
Hi, Meredith.
one word to describe your first day of your residency, what word would you use?
I'd say perfect. It was a good day.